Hello, everyone. Welcome to Health Series Podcast. Today, we're going to be looking at the topic, the healthcare system of Nigeria versus that of Kenya. Nigeria and Kenya healthcare system, though different in structure and challenges, share certain goals of improving access, reducing inequalities, and tackling pressing health issues. In this podcast, we're going to start with looking at the healthcare infrastructure. Nigeria has a federal system where healthcare is managed by three levels of government: federal, state, and local. While urban areas have a concentration of healthcare facilities, rural areas lack access to essential services. The country has both public and private healthcare facilities, though the quality and accessibility vary significantly, with many private hospitals concentrated in the urban areas. On the other hand, Kenya healthcare system operates under a developed governance structure with countries responsible for health service at the local level. This devolution was designed to improve healthcare access by decentralizing decision-making and resource allocation. Similar to Nigeria, healthcare quality is higher in urban areas like Nairobi and Mombasa, while rural areas still struggle with limited access. In the area of finance and insurance, Nigeria's healthcare financing comes mainly from out-of-pocket payment with a low level of government health expenditure. The National Health Insurance Scheme, NHIS, was introduced to provide some financial risk protection, but only 5% of the population is covered. This has led to high cost of high out-of-pocket spending, which exacerbates inequality in healthcare access. On the other hand, Kenya has made significant stride in health insurance coverage through the National Health Insurance Fund, NHIF, which covers formal and informal sectors of workers. Although informal sector enrollment remains low, Kenya's government is pushing for universal health coverage, with pilot programs launched in several countries aimed at expanding coverage and reducing out-of-pocket expenses. When it comes to human resource for health, Nigeria faces a major healthcare workforce challenge, particularly due to JAPA problem of doctors and nurses migrating to other countries. The country has a very low doctor-to-patient ratio, and many healthcare professionals prefer urban posting due to better infrastructure and resources, leaving rural areas underserved. Kenya, on the other hand, also struggles with healthcare workers shortage, but the problem is less severe compared to Nigeria. The government has been actively recruiting healthcare professionals and working with foreign governments to train more staff. Despite this effort, rural and marginalized regions still face shortage of trained healthcare workers. In the area of health outcomes and challenges, Nigeria grapples with high maternal mortality rates, a significant burden of infectious disease such as malaria, tuberculosis, and HIV/AIDS, and rising cost of non-communicable diseases such as diabetes and hypertension. Health outcomes are impacted by limited access to quality care, insufficient funding, and socio-economic inequalities. Kenya has made some progress in improving maternal and child health, reducing HIV/AIDS prevalence, and addressing communicable diseases. However, like Nigeria, it faces a growing burden of non-communicable diseases. Malaria remains a concern in certain regions, and the country is also vulnerable to emerging and re-emerging diseases. In the area of primary health care is supposed to be managed by local government authorities, but the sector is underfunded and lacks resources. There have been some community health initiatives, but the impact has been limited due to funding constraints and poor infrastructure. In any case, this might change due to the recently granted autonomy to local governments. We're looking forward to see once the local governments are better funded, we're looking to see better improvement when it comes to the way the primary healthcare sector is managed in Nigeria. On the other hand, Kenya has prioritized primary healthcare in its universal health coverage strategy, especially in rural areas. The government is collaborating with international organizations which are strengthening community health programs to increase outreach to remote areas. Efforts are ongoing to integrate preventive and primary care with maternal, neonatal, and child health services as well. In the area of public health policies and reforms, the Nigerian government has implemented several policies such as National Health Act of 2014, which aims to provide legal framework for health services, but implementation remains inconsistent. In recent years, there has been increased focus on public-private partnerships to improve healthcare delivery. On the other hand, Kenya's evolution of healthcare is one of the biggest reforms in recent years, along with its universal health coverage pilot programs. The government is working to integrate healthcare financing reforms, improve maternal health outcomes, and address health inequalities, though challenges in coordination and funding also persist. In conclusion, both Nigeria and Kenya face unique and overlapping challenges in their healthcare systems, from financing and workforce shortages to infrastructural limitations. Kenya's universal health coverage initiative and decentralization approach give it an edge in terms of primary healthcare and service delivery improvements. However, Nigeria's larger economy and higher population creates a more complex healthcare landscape, especially given the heavy reliance on out-of-pocket payments and the impact of workforce immigration. For both countries, addressing healthcare disparities and expanding access will be key in meeting health needs of their populations. I will appreciate if you like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue to explore the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.